Today, we're going to be talking about intimacy in all its dimensions, physically, emotionally, relationally. And we are honored to have with us today psychosexual therapist Emma Waring. Welcome, Emma.
Thank you for having me.
We're so looking forward to this conversation. But as our audience knows, before we dive in, we need to give you your proper introduction. So, John, let's hear the bio.
That's a must. Here we go. So, Emma Waring is a pioneering sex and relationship therapist with a rare combination of clinical expertise and deep relational insight. Beginning her career as a cardiac specialist nurse, Emma became known for her trailblazing work, setting up the UK's first male cardiovascular health clinic at Guy's and St Thomas's NHS Trust Hospital here in the UK. It was there that she first began treating male cardiac patients with erectile dysfunction, a move that earned her the Nursing Times Rising Star Award in 2004. But it was Emma's growing passion for the emotional and relational dimensions of intimacy that led her to retrain as a psychosexual therapist in 2004. Since then, she's worked with men, women, and couples from all walks of life, helping them navigate sexual dysfunction, intimacy blocks, and communication breakdowns that so often go undiscussed. She set up a dedicated psychosexual clinic at London Bridge Hospital and later qualified as a transactional analysis counselor to deepen her therapeutic toolkit. Emma is also the author of Seasons of Sex and Intimacy, a book we'll be talking about as well as we go through this. It's a wise and down-to-earth guide to evolving sexual needs of couples through every stage of life. She speaks regularly in churches, clinics, and conferences, tackling taboos with compassion and bringing fresh perspective to one of the most misunderstood areas of committed relationships. She was also part of the team that refreshed the marriage course and the pre-marriage course as well in 2019, along with Nikki and Scylla Lee at HTB, Holy Trinity Brompton, here in the UK, and she's featured on both of those. So, Emma, you've been helping couples with intimacy and sexual issues for over 2 decades now. I think the numbers go back to. What is it that most people misunderstand about sex in long-term relationships?
Oh, that's a good question to kick off with. I think that people don't necessarily recognize that sex has seasons, as life does, and I think that often people will get into a relationship and sex will be good, particularly initially in the sort of honeymoon phase, and they then have an expectation that that is how their sex life will progress for the entirety of their relationship together. And they don't necessarily appreciate that things will come across their path, life events, illness, trying for children, having children, bereavement, mental health issues, redundancy, infidelity, you name it, that will deeply or has the potential to deeply affect them emotionally, relationally, physically, if you're dealing with something like prostate cancer or breast cancer, which are very common cancers for men and women. So I think there isn't perhaps an appreciation that that sex isn't necessarily always going to stay good. And we have to commit to addressing those issues and working at it. And we have to be intentional about that. And I think that's quite a challenge for couples, because if we buy into the message that the media presents, if we're with the right person, we should be having lots of sex. Sex should be really good. It should be spontaneous. We should want it at the same time. We should be orgasmic at the same time. We need very little foreplay. All of those myths. And then, of course, that sets up an unrealistic expectation. So we're not really grounded in real sex and how real sex works and the challenges that we face. And I think if we can embrace those, then we're onto a winner, really.
Wow.
But you got me thinking now. So if it is going to be in seasons, how long do these seasons last? We can't stay in spring or summer. I'm guessing we'd love to stay there, but how long do these seasons last typically?
That's so true. And actually, the title of the book, Seasons of Sex, talks about the seasons. So I talk about spring as being often quite early on in a relationship where sex is new or the relationship's new and there's excitement and novelty and spontaneity and you're getting to know each other. And then summer, where you've kind of settled down and sex is good and you understand how each other's bodies work and you understand what you enjoy. Autumn is an interesting phase where you might feel sex is a bit boring, and I think that's okay as well. There's a great phrase that Metz and McCarthy, two American sex therapists, in their book Enduring Desire use, which is the good enough sex model. They talk about recognizing that sex can be on a spectrum, and it can be absolutely incredible and the earth can move, and it can be really good, and it can be good, and it can be okay, and sometimes it won't be okay, it might be a bit boring. So you might be, in autumn, you might be recognizing that, oh, you know, I'm a bit lethargic, or I'm feeling tired, or I'm juggling a lot and my desire isn't what it used to be. And I think autumn is a really key time for couples to talk about what's going on, because what I do say in my book is you don't want to go to winter.
Yeah.
And I reference Narnia in winter, you know, the frozen snow scene where, you know, it's cold and frosty. And I think a lot of the couples that I see in my work have got to winter. And perhaps they haven't been able in the autumnal season to recognise things are changing, or they've recognised it, but they don't know how to broach it. And then couples often come to me, or individuals I'll see, who will say, actually, I haven't had sex for a year or 2 years or 5 years or 10 years. And they haven't really known how to navigate that time where they recognise there's been a shift and they don't really know what to do about it.
So, of course, everybody will be wondering now, can spring come again after winter?
Yeah, I do you know what? It definitely can. And we need to be realistic. So I think, you know, it won't be the spring that perhaps we encountered when we were first with a partner and our bodies were younger. Not as tired. And, you know, as we age, we have to recognize that our bodies age and they change. So, you know, I think there are things, we might have arthritis, we might have aches or pains, or, you know, we may be on medication that dampens down our sex drive. It could be all a host of things. But in answer to your question, yes, I think so. And actually, often people will say when they go on holiday or they go away for a weekend, or there's a big shift in their life. So maybe their children have left home and suddenly it's the two of them again and they've got more time. And yeah, so I definitely think that spring can come back, and it might just look like a slightly different spring, but it has the quality of something that feels really good and exciting.
So one, I guess, a follow-on question from that. Some people might be asking, you know, spring might come again, but maybe spring has to come in a different relationship. Can spring come again with the same partner? Or I guess that's what some people will be thinking, you know, it's never going to work here anymore. This is dead. I got to go look elsewhere. What do you say to people who come with that mindset?
Definitely. And there's an interesting phrase that Esther Perel, you're probably aware of Esther, that the wonderful sex therapist uses, and she said most of us will have 2 or 3 marriages in our life, and for many of us that will be with the same person. And I love that. And I think, you know, so in answer to your question, yes, I think you can get spring with the same partner. But at its heart, I think the key is communication, really, really good communication. And I don't think we can get away from that. In order to have a really good and satisfying sexual relationship with a partner, we do need to be able to talk about sex. And I'm often asked by people, what's the single most important thing that impacts somebody's sex life or a couple's sexual relationship? And I will always say communication. And I think it's the thing people don't want to hear, because sex is really difficult to talk about. It just is a difficult subject to talk about, even with the person that's closest to us.
So that's a good segue into distinguishing between sex and intimacy.
Yeah.
Because that's where this whole idea of communication and really creating that bond comes in. How do you coach people to understand the difference and to work on intimacy, not just physical sex?
That is a really important question. And I think one of the things that is quite important or can be very helpful for couples to understand is that men and women in this area can function slightly differently. I don't want to say sort of generalized stereotypical statements, blanket statements, because I think there's been a bit too much of that when we talk about sex. But one thing that does seem to come out from the research in committed relationships is that women are more likely to want to be physically intimate with their bodies if they feel a level of emotional intimacy with their partner.
Mm-hmm.
So they seek sex when they feel emotionally close. Men are or can be different, and men will often seek emotional intimacy through sex. So they will want to have sex in order to create the climate of feeling emotionally close. The reverse is often the case for women, and that can cause some problems because
Yeah.
you're seeking it for different reasons.
Timing's off.
Yes, exactly. So I think actually talking about that away from the bedroom is a really helpful thing to do. And people will often say to me, "Well, how if I'm going to broach a subject with sex with my partner, how should I do this?" And I will say, first of all, give them the heads up. So it's not ideal to do it in the midst of being sexually intimate, or perhaps something's gone wrong, and suddenly you want to vent, because you're often physically intimate at that stage as well. So much better to take it out of the bedroom and to say to your partner, I'm aware, and to talk about it from your perspective. So the person is less likely to be defensive. So not the last 2 times I've approached you for sex, you haven't want to, and that makes me feel really rejected. But coming from a position of, and I know you talk about this in your 4 habits, and I love this, curiosity rather than criticism. So you might say to your partner at a good point when you feel they're receptive to listening, I'm aware that something's shifted in our sexual relationship and I'm really missing it. And I wondered if we could talk about it at some point. Now, you don't want to immediately put them on the spot and they be expected to talk about it. Give them the heads up. And it might be that they say, oh, okay, where's this come from?
Yeah.
And then you might say, well, I'll tell you what, why don't we earmark some time, maybe have a glass of wine, sit down, earmark some time, we're not going to be interrupted, and we can talk more about it because I'm aware that I've kind of sprung it on you.
Yeah.
I think that's really key. And then to come at it from a position of how you are feeling, not how you are being made to feel by another person.
Yeah, love that.
Yeah, that's a really good advice, and especially not springing it on them, but saying, let's book a time outside of the bedroom to talk about it. Pushing further, I suppose, with this idea of women experiencing life differently from men in certain ways. There's a lot of talk now about women getting older into menopausal years and re-evaluating their entire life
New
new
sure.
season, you know, and things that they've missed and not had, and creating resentments maybe and feeling like they've lost their identity. Tell us what you're seeing in that space and how couples can navigate that time.
You've raised such an interesting point, and it's something that I've really begun to think about. So I think it's important for us to think about menopausal women will have been parented by, so let's say you're in your 50s, you would have been born kind of end of the 1960s into the 70s, and you think about your parents and the generation that they were and their views about sex. So it's very likely that some of that will have been distilled to you. And there would have been messages around perhaps women not being entitled to sexual pleasure. There would have been a mismatch in terms of the focus being on male pleasure and not female pleasure. And of course, thinking about a patriarchal society and all of those bigger sort of factors. But in answer to your question about menopausal women, what I'm seeing is I'm seeing a lot of women who are hitting the menopause and they don't want to have sex anymore because they're having problems associated with that. So we have a syndrome, genitourinary syndrome of the menopause, where you have physical changes that can cause things like a chronic thrush, recurrent urinary tract infections, because your body is changing. And this group of women have often not been vocal about what they've wanted in sex. They haven't perhaps even known it. They've sort of gone along with sex with their partner. And I don't agree with, or I don't like the term they've laid back and thought of England, but there's been a sense of, I've got to do my duty. I've got to do my duty. My partner wants sex and I will give him sex. This in heterosexual couples, I will give him sex, but actually the focus has not been on the woman's pleasure. Now that was tolerable when she wasn't experiencing unpleasant issues.
Yeah.
Such as chronic thrush, urinary tract infections, or bacterial vaginosis, all number of things. But suddenly, actually, sex is causing these things, and she doesn't want to experience that, so she doesn't want to have sex. And so, actually, that can be a really good time to get the couple, although it can be difficult because they may have been together for 30 years, to get the couple to say, okay, over the last 30 years, you've had a sexual relationship, but you've never talked about it. For example, does the woman experience an orgasm? And if not, why not? And what's been going on? And what's in your sexual repertoire? Is it just a case of minimal foreplay, penetrative sex? The man has an orgasm and that's the end of it. Where's the discussion around what you are both enjoying? So it can be a pivotal point, but it doesn't have to be the end. It can be the beginning for some women of exploring their sexual enjoyment and thinking about, actually, what do I want for myself in this sexual relationship that I haven't had for the last 30 years? So it can be a great crossroads point in a relationship to get a couple talking.
And it's one of those conversations that can send you into the winter if you're not careful, certainly into the autumn, and no come back from that unless you have those conversations and unless you address them. And I can see that you're going to pick up on that.
I was going to say there are so many different directions that we could take that conversation. So many different things we want to talk about that might not be connected, but maybe they are. So, for example, if they're not able to talk about what's happening sexually and their own desires, and somebody ends up, finding sexual pleasure outside the home, or gets involved in porn online, or with prostitutes. I don't know. There's a whole mix of solutions that people might have come up with because they find it so difficult to talk. How do you help couples navigate that if something like infidelity were to happen?
Yeah. So many directions. It's such a deep question because there are so many. I suppose at the heart of it, whether the person's been they've sought sex outside the relationship or they're looking at porn in secret or whatever it is, the question has to be, why haven't they spoken to their partner? What is it in the relationship that stops them being vulnerable? And what stops them taking a risk? And what has been the emotional or connective climate in that couple? How have they navigated conflict in their relationship? Do they just withdraw and not talk about it? What has stopped them being able to say? So, for example, in the case that you've referenced of a menopausal woman, it might be that she grew up in a family where she very much got the message that actually sex was a bit dirty and nice girls didn't have sex, and they certainly didn't initiate it, and maybe they just had it but within marriage. So the messaging that they got around sex, they've then taken into their relationship, and they've not been able to unpack that with their partner. They've just gone in with this kind of deep message around shame, perhaps to do with their bodies. It's really common for me to meet with women, not men, interestingly, women who've been told off as young children for touching their genitals.
Mm.
So their parents have smacked their hands, or they've said, don't do that, that's dirty, you shouldn't do that. And I just don't get that message from the men that I work
Mm.
with.
Mm.
It sort of seems to be an just accepted that,
Mm.
that's okay for young boys to touch their genitals in a way that it's not for girls. So I think it really depends on the messages you've grown up with. What were your parents' views around nudity? What were their messaging around sex? So I think we've got to think about what have we and our partners brought into the relationship, and what have been the roadblocks to us actually saying. So, for example, with that woman, what stopped her saying, I know that we have sex once a week, but I have to be honest, I'm not really enjoying it.
Mm.
Why hasn't she been able to say that? And maybe she hasn't sensed that her partner is interested in her sexual pleasure. Maybe there is nervousness on his part around being sexually inexperienced and not really knowing how to give his partner pleasure.
Mm.
So again, it's a void that's kind of never discussed. So you can get through this, and you can come out to a really good place, but it does involve some discussions where you are likely to feel vulnerable.
Yeah.
And I think if you can do that in a kind way, I know that's one of the other things you talk about in your 4 habits, the importance, particularly with this subject of being kind. Because I do work with people who will say to me, I had a relationship with somebody and they compared me in an unfavorable way to an ex-boyfriend or an ex-girlfriend, and it's really stayed with me. Or they've commented on the size of my penis, or they've commented on my the size of my breasts, and I've always felt self-conscious. So I think we have to recognize we have to treat this subject with kid gloves, but it doesn't mean we don't go there.
Yeah. Wow. There's so much here. I'm conscious also that we've been speaking a lot about, I guess, the older generations, the boomers, the Gen Xers. Are you seeing any similarities, or what can you offer for any trends, anything you can offer to the what does it mean now, the Gen, what's now, Gen Z or Z or beyond that?
Itself of the different,
The Ys and the Z.
yeah. So one of the things that I'm finding really interesting is the impact of porn. And I know that you mentioned this just a minute or so ago. And, when I started out in my career in the early sort of 2000s, we didn't have smartphones. And it wasn't part of my assessment. I didn't ask people about their use of pornography. Just didn't. 25 years on, it's a routine part of my assessment. Do you use pornography? And if so, are you happy with how you've integrated this? Do you have any concerns? One of the things that interests me is, before I even ask that question often, and it does tend to be men. Again, I don't want to be stereotypical, but in my experience, it's men that are saying this to me in the consultations. They are saying to me, before I get to that question, I'm really trying not to use porn. I think it's been really damaging. It's really impacted my enjoyment with a partner. I now feel I've got unrealistic expectations about what I can expect sexually. Or I started watching stuff that was quite kind of mainstream, and now 2 years on, I'm quite shocked at what I'm accessing to get aroused and to get and experience an erection. So I'm really interested that we've got a generation that are growing up. And I listened to something this morning on a podcast saying that young people are saying that 70% of young people say they get their sex education from pornography.
Wow.
Which is
What
a real
are they learning?
given
70%.
Yeah. So it's a real worry when we think about what pornography is portraying, because it isn't real life sex. So I think that's something I've noticed. I read an article, I think it was in lockdown, about how younger generations were not having as much sex, and why was that? And again, one of the thoughts around that is the impact of devices in the bedroom.
Dopamine.
And looking at your work emails before you switch your light off. I mean, I think that's one of the downsides. I mean, there's a lot of positives about the internet, but one of the downsides is you don't leave the office and leave work at home in a way that I think you used to 30, 40 years ago.
Yeah.
You are constantly on call. And I think more so for the younger generations now, with AI coming in and a fear around getting a job, keeping a job, you're not having a career for life in the way that previous generations did. So I think there is an expectation to be constantly available. If you're constantly available to work, you're not available to your partner.
Yeah.
You're distracted, preoccupied. You can't be in the moment, in your body, enjoying what you are doing with each other, or even to yourself. If you're masturbating, so there are so many, I think, things that can distract you and are unhelpful.
Yeah. So what does a healthy mindset going into a committed relationship look like as far as sexual health is concerned? What would you want to encourage young people and even older people to be thinking or challenging in their mindset?
Well, we just jumping in there for a second. We had somebody who I remember saying, anything less than twice a week is just not acceptable. In terms of going into a relationship, that was the man's expectation there.
I mean, that's so interesting, isn't it? I think that's one of the things that I encourage people in new relationships to talk about. What are your expectations? If you're expecting to have sex twice a week and your partner's expecting to have sex once a month, you're going to run into some disappointment. So I think, again, it comes back to really good communication. First of all, I think it's important to talk about what were the messages that you got when you grew up? What in the messages in your family?
Yeah.
Like sex spoken about much. For some people, they've grown up within a family with a strong faith focus, and it will be sex. You shouldn't have sex before marriage. They might be partnered with somebody whose parents have been very kind of liberal and open, and you've got a girlfriend, boyfriend, you're 16, it's consensual, sleep together in our house, no issues at all. So again, you've got to sort of think, what kind of background have you come from, and what are the challenges that you might have, and then to think about what's your fantasy sex life like? Is it like every day, 3 times a day? Is it is it that you're going to carry me up the stairs like a knight in shining armor, and I don't need to, as a woman, I don't need to take any responsibility over my body because you will know exactly what to do to me so that I will enjoy sex? We've got to dispel some of these myths, and we've got to be real. And we've got to talk about actually, what do we want? Do we like the thought of oral sex or not? How do we feel about masturbation? I was having a very interesting conversation with a colleague the other day, just talking about how within relationships, couples don't talk about the masturbation habit. Is it something we do in secret? Is it something we do at all? Do we feel guilty? If we feel guilty, why do we feel guilty? So kind of just like, getting out all the cobwebs, shining a light on it and saying, these are uncomfortable discussions, but let's talk about what we want. And I think the other thing to say there is we don't need to make comparisons. We just need to work out with our partner what feels right for us. So when I set up the erectile dysfunction clinic back at Guy's and St Thomas's, one of the things that I was really struck by was sometimes I would be working with older couples, 70s, even into their 80s. And for them, it wasn't about frequency. So, they might have sort of aches and pains and hospital visits and all sorts of different things that they were navigating, but they really enjoyed sexual intimacy, but it had changed. And for them, they were looking maybe to have a really nice encounter with sex, maybe just once a month, or once every other week. And it wouldn't necessarily have to involve penetrative sex. It could involve touching and stimulating in other ways. And I was really struck by the couples that had been able to discuss this and navigate it, how impressed I was by them. And how I thought, wow, you've got it right. You're tackling this as a couple. It's a team. You're recognizing it's a team sport, if you like, and both of you need to be involved. And I liked the fact that the partners were coming along. Their partners or husbands were experiencing erectile dysfunction. But they weren't just saying, go and sort the problem out yourself. Nothing to do with me, your problem. And when I see that, that doesn't bode well for that
Yeah,
couple.
yeah,
I always think this is not good. The partner's got to get on board here.
Yeah.
But when I would see, in fact, we researched this. We did a piece of research asking couples. And what we found was that the couples that did best were not necessarily the couples that were having more sex, but they were the couples that were united in their view about recognizing this was a team effort,
Right.
and that they were talking about this.
Do you know, a message that's coming through loud and clear in every aspect, every direction that we've taken this conversation, is that the physical act of sex might be the spark that gets people thinking that they're in love and they want to be committed. But the thing that creates real intimacy is the ability to be vulnerable and open in communication throughout all the seasons. That's what real intimacy is.
Yeah, it really is. And it's also sort of recognizing that you're making yourself vulnerable, but also that you maybe need to be really specific as well. So it might be, I'm just trying to think of a good example. A good example would be a couple that have had a good sexual relationship, and then the woman has had a baby, and then penetrative sex is really difficult. She might have had a difficult delivery. And what I find interesting about the couples that I see is that they attempt penetration because that's perhaps what they've done historically. It hurts. She says it hurts and she might wince. He stops, and that's the end of it.
I thought you were going to say that. Yeah.
And that's the end of it. And then maybe a month later, they try again. The same thing happens. And then I will see them 2 years later. They want another baby, but they haven't had sex since they attempted those 2 occasions. So what I think is interesting there is what stops them. What stops her saying, oh, that's really painful, and then them saying, what could we do instead? Or shall we think about getting a clitoral vibrator to see if that might help, and then we don't have to have penetration? Or, you know, why don't we open up our sexual repertoire and consider other things in the time that your body is healing, and revisit penetration in 6 months? But because perhaps they haven't had those difficult, or those not difficult, but well, they can be difficult, but intimate, really intimate conversations prior to the baby number 1 coming along, they don't really know how to say, actually, it's really painful when you do that. And the other thing that is very, very typical from this sort of scenario I've described is that they will both go off, and it might be that they're masturbating, but they're doing that in secret and they're not talking about it. And I think that's really sad as well, because I think there is a sexual outlet that they're looking for, but they just don't know how to take that back to their partner. They haven't found the word. So I think if you can talk, you need the emotional connection and be able to be vulnerable. But then the other layer of that is to talk about what you're actually doing sexually.
Yeah.
You know, is it enjoyable? How do you like to be touched? What turns you off? What turns you on? But again, you have to do that in a really kind way, because you only need one harsh comment. And I hate it when you do that. For the other person to feel a lot of shame, and then they are likely to withdraw, and they may not go there again in terms of trying to start that discussion, or indeed approaching their partner sexually.
Yeah. I mean, you've been so clear that communication is the key here. I guess the question I have, and I know you use it a lot in the work that you do, is transactional analysis. Could you just share with the audience what that is very, very quickly, but how can you use that in practical terms to help people build that connection, build that intimacy, and have those useful conversations that can move themselves forward?
Yeah, so transactional analysis is a sort of mode of therapy that that is brilliant because you can find you can access lots of bits of theory online, but it's a piece of theory that you can really quickly understand, and I use it with couples to talk to get to implement change quickly. So in the transactional analysis model, I'm not sure how familiar you are with it, but it's the parent adult child model. And I won't go into the details of that. I think it's best for viewers to look it up because there's lots of stuff out there. But in a sexual relationship, what we want to do is we want to our transaction, our communication needs to be from adult to adult. And if it's from adult to adult, it's the sort of reasonable, rational part of our brain. And it's the way we think, the way we feel, and the way that we behave. And it gets quite complicated if we split that down, because we can look like we're coming from adult, but we might actually be feeling something that is from our child or our parent. But without going to the details, if we can keep our transactions adult to adult, then we are much more likely to be able to have good, clear communication. An example of not being adult to adult might be somebody approaches their husband for sex and he says, "I'm too tired." And then she swears at him, says, "You're always too tired," and storms out the bedroom and slams the door. That she has gone into either the critical parent or the rebellious child. So she is not in her adult. And that doesn't mean to say that in adult all conversations are easy, not at all. But what she might do is she might keep that to herself, and then the next day she would have the conversation that we talked about right at the beginning, which is, "I'm really aware that something shifted. And I felt really sad last night when I approached you because I really wanted to have sex with you or make love or whatever the terminologies you use. And you said you were tired and I really miss it. And I just want to understand what's going on." So that would be an example of coming from your adult. It takes a lot of practice because in the moment, if we're hurt and we feel rejected, we want to lash out.
Yeah.
And it's the other person's fault and they've made us feel this way. Being an adult is about owning and taking responsibility for how we're feeling, but not discounting it. Absolutely saying, "I feel hurt and I feel rejected," but doing it in an appropriate way where you're going to get more buy-in from your partner.
Yeah. Yeah.
I just want to pick up on that example because I love the example that you gave there. But is that a general example from your experience? My brain and my I guess stereotypes out there would be it's the other way around, where it's the man asking for sex and being told no. Do you see a lot of it the other way around, where the woman is initiating and the guy's too tired or not interested or what have you? Is it a 50-50 split, or what would you say there?
No, it's not quite 50-50, but it's much, much more common than you think. And there is this stereotype that men are always up for it and women have to be cajoled. And it's high days and holidays, or they've always got a headache, or, these sort of stereotypes.
Yeah, that's a stereotype. Yeah.
Yeah. No, I don't find that at all. I find I meet with lots of women whose male partners have lost interest in sex. And I think it is very, very painful for them, predominantly because of the stereotypes. So they might be mixing with female friends who are saying, "Oh, my husband wanted sex again last night. We've already done it twice this week." And that poor woman is thinking, if only he wanted, my husband wanted to have sex with me. And there's a lot of shame around that. And it would be very difficult for her to then say, "Actually, I've been approaching my husband and the last 2 times he's rejected me and we haven't had sex for 6 months." But I do see a lot of women whose partners aren't wanting sex. And again, I think that's for a whole host of reasons, but I think a lot of that is to do with changing roles in the family, some shifting of power dynamics, I think work pressures, lots of reasons.
So I know we're coming to the end. who are your patients? Who comes to you, and why do they come to see you? Because even that must be a difficult moment for people to make the decision.
Yeah. I think that when people come to see me, they're quite desperate. And often they lived with a sexual problem for a very long time. So I work under the umbrella of a hospital. So I have a sort of nursing hat, a psychosexual hat, and my transaction analysis counselling hat. So I kind of cover all bases. But the reason that people usually seek help is because they have a functional issue. So by that I mean, for men, the most common issues are erectile dysfunction, so an inability to get or maintain an erection sufficient for penetrative intercourse. That's the definition of erectile dysfunction, which is very common. 1 in 10 men will experience erectile dysfunction. Most men in their life will experience it, but for some men that will last. Ejaculatory problems, inability to ejaculate, ejaculating too soon. So we used to call it premature ejaculation, we call it early ejaculation now. For women, it will be or women and men, but mainly women, it will be dyspareunia. That's the medical term for painful sex. And that can be caused by lots of reasons. Some of the reasons we've mentioned: urinary tract infections, thrush, vaginal conditions, dermatological conditions, lichen sclerosis, all sorts of things. It's more and more common in men, actually. And the reason for that is a tight foreskin, or a phimosis, which is a tightening or a stiffening of the foreskin, so it's difficult to retract over the glands of the penis. And then a condition called vaginismus, which is an involuntary spasm of the vaginal muscle. And that means that penetration is very difficult, or in lots of cases impossible. I tend to see that with a younger cohort of patients, and they usually are wanting to have children, but they can't have sexual intercourse. Sometimes you can get secondary, so that's primary vaginismus. Secondary vaginismus might be after a difficult delivery of a baby, or after something like a sexual assault, where somebody has experienced sexual trauma. And then the final condition, which is the most complex condition, is low sexual desire. And low sexual desires can be for a number of reasons. It can be because you've got a physical functional problem. If I have erectile dysfunction, I'm likely to go off wanting sex, because if I try and have sex, my penis doesn't work, and I therefore don't want to have sex. So like the two go hand in hand. So sometimes the low sexual desire is a secondary condition to the presenting problem. Again, if sex is painful, I'm turned off. So you sort out the functional physical problem, the desire comes back.
Right.
The second reason can be because I've got low sexual desire because I'm not enjoying sex. The menopausal woman that we mentioned at the beginning, I'm not enjoying sex. I've managed to sort of grit my teeth and get through it the last 30 years, but I'm not enjoying it. And therefore I don't want to have it. And then the final thing linked with low sexual desire is that the couple don't like each other. They are in conflict. They can have sex physically if they wanted to. There wouldn't be a problem, but they don't like each other.
Not up for it, yeah.
There's a great line in a Michael Bolton. I have to admit, I'm a Michael Bolton fan, but how can we be lovers if we can't be friends?
There you go.
And I see that. So actually, it's not really a sexual problem. That the lack of sex is a symptom of a relationship that's in conflict and in turmoil. And the couple actually need couple counselling. If they can get couple counselling, and they can get some goodwill back into the relationship, and they might be conflict for all number of reasons, but they get goodwill back. They have some couple counselling or even individual counselling, and then the sex sort of comes back on its own accord.
Yeah, knowing what the cause is. I always remember this book, Sex Begins in the Kitchen, which meaning, help with the chores, help with the other stuff before you come
that
to
means
Monday.
clearing the kitchen table and doing what you got to do.
I know, we hear two different things when we hear that.
It's interesting because you'll be very familiar, I'm sure, with the 5 languages of love, or the love language,
Absolutely,
Gary Chapman's work.
Yeah.
And, I do think they play a really key role when we think about sex, because For one couple, the partner might come back from work with a huge bunch of flowers, and oh my goodness, that just injects goodwill, because gifts is a love language that's
Yeah.
really valued. For somebody else, it might be acts of service, so they don't care less about the flowers, but their partner clears the table, wipes down the surfaces, makes the packed lunch for the kids the next day while their partner goes has a bath. Transformative. They get
Yeah.
to bed and, they feel close. They feel like they've connected on some level because they've shared the burden of
Yeah.
family life.
And they feel seen and
They feel
supported in that moment. Yeah.
supported, which I think is so key.
Just on that example of the flowers there, we had an example of a couple that we were speaking with, and the husband had done exactly that. He brought this bunch of flowers. I think it was Valentine's or it was some special event. Brought this bunch of flowers thinking, this is what they were actually in financial hardship at the time. But he sort of spent his last whatever he had on this bunch of flowers thinking this will really do something here. And the wife was furious. How could you waste the money on that? All I wanted was a bottle of wine and we could sit together or what have you, waste. So just getting it wrong can make such
It's so sad, isn't it, for that couple, because they both have a need and
Yeah.
but
And the
they
desires.
miss each other.
Yep.
Mhm.
Comes back, doesn't it, to talking.
Yeah.
What are my partner's love languages and how can I meet those?
Yeah.
Particularly, how do I meet them if they're not mine? And that's something that I see that's a really interesting thing.
Yeah.
Yeah.
Yeah. And going with the assumption that, well, this is my need, must be your need as well. Let's do that.
Exactly.
Yeah.
We could have spoken about so many things.
I
I'm
know.
loving this conversation. We've certainly gone there with so many things. We even touched on Michael Bolton. I mean, we've covered everything in this. But how, Emma, how do people find out about you if they want to get in touch with you? What do they need to do, and how can they also find out about these seasons of Sex and Intimacy, the book? Tell us about both of those.
So they can contact me through my website, emmawaring.com, and there is a contact page there, and you can just email me directly. They can get the book from, dare I say, Amazon and all good bookshops.
All good bookshops, yeah.
Some, like Waterstones and other books, they have to do a specialist order, but certainly they can get it that way. And then there was something I was going to say then that has slipped my mind.
You're going to show us the book as well for those who are on camera.
Yeah.
There you go. Seasons of Sex and Intimacy.
Yeah. So this particular book had a focus for Christian couples, but one of the things that I've really enjoyed about the reviews that I've received about the book is, actually, I'm not Christian, I'm an atheist, but the book was really helpful because kind of 98% of it is practical. So don't be put off if you don't have a faith. It's a very practical book. It's kind of thinking about what I use in my work that is helpful for couples and putting it into a book. And just to say on that note, two things. Sex therapy isn't rocket science. Like, a lot of the stuff in the book is really common sense, but people don't know about it. So, for example, a young couple might think they shouldn't use lubricant in sex because that's just for menopausal women or older couples. If we can dispel myths, things like using vaginal lubricant can really help couples where sex might be a little bit painful. So sort of just top tips and tricks of things that can make a big difference. So you don't necessarily need to go off and see a sex therapist. There are lots of things couples can do for themselves. But the other thing to say that I do stress in the book is, and I said to you, when I see couples, they're often really desperate. And that's because they've been living with the problem for years. They've not spoken to anyone else about it. If you have a sexual problem, if sex is not working for you, you're struggling with an aspect of sex, your body is not responding as you want it to, or there's an issue in the relationship, seek help quickly.
Yeah.
So couples seem to do much better. And I say in my book, if you're struggling with a problem, talking about couples that are newly married, if you're struggling to have sex or an aspect of sex is difficult, seek help after 3 months.
Right.
Not very long at all. And many of the couples I see have lived with the issue for years,
well beyond that, yeah,
sleeping in separate bedrooms. So you've got to address that, getting the couple back together, just to feel comfortable being physical with each other and naked, being in the same bed, before you even address the sexual issue. So seek help quickly. And there are lots of things you can do to help yourself, and you don't need to seek professional help.
That's so interesting. Final thoughts on this trend to not just sleep in separate beds, but separate houses.
Yes, I've been, there's a phrase for it, isn't there? I can't remember, I heard it the other day about couples that are choosing to live separately. Yeah, it's an interesting one. Esther Perel talks about the fact that we need some separateness in our relationship so that we can meet together. There's a bridge we can meet in the middle. So we need to have our own passions, and we need to pursue our own passions outside of the relationship, hobbies, whatever it may be, in order for us to come back together. And of course, that's what's so enjoyable about dating, isn't it?
Yeah.
You're separate and you come together, and how exciting that is. And I guess for people living in separate houses, they're taking that to a real extreme.
Oh, we'll have to bring you back for the conversation to follow. But Emma, thank you so much. Rapt attention, I'm sure, from the audience. You certainly had that from us. Thank you for giving so generously of your time and your wisdom. And, keep doing an amazing work. Thank you.
Thank you.
To our audience around the world, we say thank you for joining us yet again. I'm sure they've been taking some notes. I've been taking some notes here as we go. There's so much here. Just thinking about the seasons, though, that we're in, and just sort of recognizing where we are, and actually, how do we extend that season or get back to a season? Communication, as Emma's sharing here with us.
Yeah, how do we stay connected and stay intimate through all the seasons?
Yeah,
that's the key.
But for now, it's a wrap, and it's bye-bye.
It's a wrap. Bye-bye.
Thanks for tuning in to the 4 Habits podcast. Now, if today's episode resonated with you, share it with someone who needs to hear it. And don't forget, take our free relationship skills quiz at the4habits.com/skills quiz to start improving your relationships today. Hit subscribe, and we'll see you next time.